Hi, everybody. This is the Dr. Debunk weekly podcast show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Today's podcast is about doctors' dirty little secrets, Part 3. So hopefully you've listened to Part 1 and Part 2. So what is Part 3 of the dirty little secrets of doctors in medicine? Here it is. Doctors think when we go to the bathroom, sherbet comes out of our butt. That's funny. Don't you think it's funny? I always like that one. Here's what it means, really. It means that we think that whatever medical truth or treatment protocol or belief system we have right now, today, is absolutely correct and final. And how dare you say otherwise? How dare you question it? It really amazes me after 32 years in medicine how this belief is still so pervasive. Now, what do I mean? Right now, we doctors have treatment protocols for all of the main medical problems we deal with, both for disease conditions and non-diseased conditions, or just dysfunctional conditions. So a common disease condition is cancer. And so we have very definable treatment protocols for each type of cancer that we commonly see and treat. And then, so a common condition or dysfunctional non-diseased condition would be like the flu. How do we treat most patients for the flu every year? It's very definable. I mean, the flu isn't a disease. It's just a viral infection that causes dysfunction of the normal state of your body. And so here too, we have specific medical protocols and ideas of how to treat the flu. So here's the problem. We act like the current way we treat the medical problem is the only way. And how dare you suggest something different? Debunk, 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 debunk. Here's what's wrong with that belief system. Here is the problem. Every 20 to 30 years, we generally redefine what the current medical treatment should be. We have a new way to treat something that can sometimes be the exact opposite of how we've been doing it for 20 to 40 years. We say things like, oh, no, that's not how we do it anymore. That's not how it works. We have a new, better treatment. We almost act like it was some other profession that was doing the previous treatment. It's like a denial occurs. It's like, we didn't do that, because each year generally, but not always, we're gaining more medical knowledge, more scientific and medical knowledge about a condition, and then it changes our reality of that condition. Basically, we realize, oh, the body didn't work the way we thought it did. It works differently. And so many times, we realize that we were not actually making the patients better in the long run with the old treatment protocol. So here's an example so you get it. So when I was an intern, of course, that was back in the Stone Age when the dinosaurs roamed the earth, we always stopped a blood pressure medicine that were called beta blockers when a patient was in congestive heart failure. Because the belief at that time in medicine is that a beta blocker would cause the heart to fail more quickly, thereby killing the patient. Not good, generally not good. I've read that somewhere in a medical textbook. But 15 to 20 years ago, I don't remember, a doctor challenged the classical medical views about beta blockers. And he said the exact opposite would be true, that beta blockers could help patients get better faster when they were in congestive heart failure. Well, this doctor, oh my gosh, they burned him at the stake. They stuck knives in him, figuratively speaking, of course. I mean, they were like, how dare you challenge the standard wisdom? You're going to kill people. Rah, rah. It was like the claws came out. Guess who was correct in the end? The innovative doctor. Now, right now in medicine, if you don't give beta blockers to patients that are in congestive heart failure, you are considered negligent in your treatment. I mean, and it takes too long to explain why that is, but it's because our knowledge of the physiology of the body changed, of how the heart worked in congestive heart failure. And we realized that basically a little pinch of beta blockers would rest the heart. This doctor flipped the way we thought about it. And the list of conditions like this goes on and on. How many days do you have? And I could list them for you. Physicians changing treatment protocols occurs dramatically over many years. And along the way, always insisting that this current treatment protocol is not only the best way, it's the only way, is ridiculous. Now, many doctors don't do that, to be fair. But the big centers, Harvard, Stanford, all the hoo-hoo places with the hoo-hoo doctors, I mean, they think they're elite. They think they're the only ones that, has the gold sherbet coming out of their butts. I mean, physicians like me are little peasants, and how dare we challenge their vast and all-encompassing knowledge. Now, that's not always true. I have had a few conversations with the hoo-hoos at Stanford or whatever, and they were nice. It's a mixed batch. So I'm not saying all hoo-hoo doctors are that way, but it can get in your head if you're at the big centers. Anyway, that's a different movie. I'll critique them later. So I could give many examples, but the point is this. I'm not just critiquing my kind for sport, although it is so much fun. I mean, we love to critique, don't we? I'm saying this to encourage you to challenge your doctor's opinion if it goes against your common sense of your body. Now, I didn't say common sense of your brain, but I mean the common awareness you have of your body, especially ladies. Women, you are not hypochondriacal. Your nervous systems are wired differently than men. You feel stuff that we don't. I mean, men, are wired differently. We're kind of brutes. In fact, scientifically, maybe you ladies didn't hear this. Scientists have researched, genetic researchers have figured out what human males are. We are a cross between an ape, a dog, and a pig. I mean, isn't that true based on our behavior? That's a good joke. You should be laughing. Anyway, ladies, you have more nerve endings. You have more sensory input than men do. And so you're aware of your body better than we are. It's really true. And so I am saying that if it just doesn't seem right to you, I don't care if he's a hoo-hoo doctor, ask questions. Get another opinion. If you get blown off, if the hoo-hoo throws you out of your office and says you're a dumb blonde, then get another opinion, especially if you're getting surgery. Surgery, folks, is absolute. That means once you get chopped, there's no going back. Chop, chop, body parts gone. You can't put them back. You can't take it back to the store. There's no returns with surgery. The reality here is there's always more than one way to treat just about everything in medicine. And for non-diseased condition, there are many ways to treat the nuisance conditions of abnormal physiology or abnormal functioning that occurs in outpatient medicine. Many alternative medicine treatments are superior than to standard doctor treatments. And as time goes on, I will be putting all of my natural treatments I've developed over 32 years. There's about 40 medical conditions I can treat, from blood pressure to diabetes to osteoporosis, that you can use that are based on real science with real outcomes. Anyway, because all of these other treatments are generally about helping or enhancing your body's ability to heal itself, thereby freeing you from chronic drug use that weren't really necessary anyway if you would change your life. But we've already talked about that. Anyway, I am encouraging you to ask questions. And if a doctor won't give you the time, especially if they're thought out questions, or the doctor acts like this is the only way to do it, you should run for your life, literally. There's not only one way to do it. So finally, the practical application for all you patients out there is not to argue with your doctor if he won't hear you. Just go home and see if you can validate or disprove their point of view. It is really not valuable to argue with doctors because we don't want to hear it. I guarantee you that. You need to go look at your condition. The day is long gone, folks, that you can blindly trust your doctor. Blind faith is not valuable in anything. There was a time where Americans could really get great care from the doctor and not be concerned about it. You were getting the best care, but that day is gone. It's too complicated. It's not that doctors want to do it. It's not going to happen. You need to know about your condition. You need to get second opinions from another doctor. You need to get a second opinion from an alternative health provider if that seems to fit your condition. And you should travel significant distance if you must, especially for surgery. I mean, I live in rural California, and I send patients a long ways for certain surgeons because we just don't have the surgical skills here. The physicians here, I just won't use many of them. They're just not skilled enough. And some of them are butchers. I mean, I wouldn't let my dead dog go to them. So, information is key, or you're going to be stuck with drugs or the knife, and you don't want to. Medicine is always changing. Our protocols are always changing. It's not absolute. I'm Dr. Debunk, debunking medical myths, garbage, and crap spread by doctors and other health professionals. Thanks for listening. Now a word from our sponsors. Hi everyone, it's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller.